cataract is the natural lens inside the eye that just loses its clarity over time. And as it loses its clarity, the vision deteriorates.
Dr. Richard Gans is an ophthalmologist at the Cleveland Clinic and an expert on cataracts.
They see more troubles with glare. Headlights coming towards them at night are difficult. They see halos around lights. They feel like they need more light to see things because their contrast sensitivity diminishes, and their color perception changes as well.
Look up, sir, and look down.
Though they can develop at any age, it's mostly an issue for the older population.
If we live long enough, everybody gets a cataract sooner or later. There can be some situations where it's hereditary. There are some infants that are born with cataracts because of infections or other problems, some metabolic diseases. Diabetes, unfortunately, makes cataracts develop sooner in life than it might otherwise. So there are a variety of different factors.
Thankfully, these days it's a pretty easy fix.
Fortunately, we have a wonderful technique that allows us to remove cataracts and replace that cloudy lens with an artificial lens that restores vision and gets people seeing well again. The surgery is outpatient. It's done under a local anesthetic, but with medicine to make the patient nice and relaxed and comfortable. It's a very quick operation without any pain, and the patients are up and around and functioning. Literally the next day, they're already starting to notice some improvement in the vision. The nice thing about the lens implants that we have is that they can optimize a particular visual distance. So most of the time we correct people for distance vision. They can drive and see very well in the distance without glasses, but oftentimes they need glasses to read with. If they have other problems like astigmatism, which might require correction, there are actually surgical options now that allow us to correct astigmatism as well.
There are secondary benefits as well.
There's very good evidence that suggests that people who have had cataract surgery are at 50% less risk of being at fault in a motor vehicle accident for the first several years after surgery. There's a less likelihood of falling and a substantial decrease in the number of fractures. About a 30% reduction in hip fractures in the first year after cataract surgery. There's evidence that it helps with depression, it helps with overall quality of life, and there's even some beginning evidence now that suggests that people that have had cataract surgery actually live longer. It's a wonderful procedure, and it's a real treat to be able to provide this for people. Every day I realize that there are people who are potentially at risk for losing their jobs, losing their independence. They can't read, they can't do things that they want to do, and to be able to restore that with a very quick operation is a real treat.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.